So, a warm welcome, everyone, to episode 3 of our Talkroom series of podcasts, Being Your Best Self. I'd like to start today by introducing my co-presenter, Ian Stockbridge. Ian is an accredited counsellor with the British Association of Counsellors and Psychotherapists and a founder of Hope Therapy and Counselling Services.
Thank you, Wendy. And for those that have watched our previous podcast, Wendy needs absolutely no introduction. And for those that haven't had the opportunity yet, Wendy is a hugely experienced CBT psychotherapist who's been involved in the field of mental health and well-being for well over 30 years now. So an absolute pleasure to be here once again with you, Wendy.
Thank you very much, Ian, for that warm welcome. So these podcasts look at the question of how to be your best self. Now, Ian, I do that by looking at the question of mental health and well-being from the perspective of a variety of counselling and therapeutic approaches. But today, we will be discussing the subject of acceptance and commitment therapy, or for short, ACT. What ACT is, how we use this to support ourselves on a day-to-day basis, as well as how we may look at the question of overall mental health and well-being. So, Ian, as a counsellor who integrates ACT into your work, could you please explain what ACT is and how it came about?
Yeah, sure. I'd be happy to, Wendy. So acceptance and commitment therapy, so ACT, is an evidence-based therapeutic approach developed back in the 1980s by a chap called Stephen Hayes, and then various people have come along since, people like Kelly Wilson, Kirk Strozel, really well-known people in the field of ACT, and further developed the original ideas. ACT is often described as being an offshoot or a development, if you like, of cognitive behavioral therapy, so CBT. It's often referred to as being a third wave CBT-based approach, so a slightly more modern evolution or enhancement of the CBT way of working. And you might say that there's two elements of ACT. So the first is acceptance. So very much about acknowledging or accepting that this is how things are for us right now in this moment. So seeing our current situation without exaggerating it, but also without denying it. So seeing it how it actually is. And then the commitment part is ACT as a behavioral therapy. So it's the B part of CBT. And it's very focused on behavior. So making a commitment towards possible and desired change through action. So a very behavioral way of working. So once we really see what our situation is, we make commitments to actions to change it to the extent that that's desirable and possible to do, but not just any old actions. We're looking at actions that are aligned to our core values. So living the life aligned to the person that we want to be as best we can. What do you want life to stand for? How do you want to treat yourself and others? So really considering and exploring those types of value-based questions and taking active and committed steps towards those things as best we're able to do.
Okay, thank you, Ian. It sounds a very interesting approach. I'm very interested in what you've got to say about it. But it sounds quite different to the traditional cognitive behavioral therapy approach.
Yeah, so whereas it still comes under the broad umbrella of CBT, there are certainly differences in terms of focus and in terms of approach. So whereas traditional or more classic CBT approaches can often focus more on challenging or questioning thoughts and belief, ACT tends to be more focused on accepting, accepting that this is in this moment our experience. So we don't get into the question so much about the rights and the wrongs of our thoughts, but it's making a conscious and committed effort to make those value-based changes that are both desirable and possible as best we can. It's very focused on mindful awareness. So knowing how things are without ruminating about them, but also not exaggerating them in our minds either. So seeing them as they actually are. Okay. Reaching acceptance that in this moment, this is how it is right now, without losing the more traditional behavioral based interventions that we might associate with a more traditional CBT way of working that can be really helpful in enabling us to make committed change in the first place. So I know how it is. I know what I want to do. Now let's make some changes as best we can.
Okay, that's really interesting. Thank you, Ian, for that description. And I really picked up on the word that you said there. You stressed the word consciousness there.
Yeah.
Can you tell us a bit more about that?
Yeah, so it's very much about conscious or mindful action. So taking value-based actions as a deliberate or conscious thing with full awareness to our experience and what we're doing. So this is how I am. This is what I'm going to do. So not simply acting out of habit, not just following the same patterns of thought and behavior as we've done historically, but making conscious, value-based decisions to make change to our life as best we can. A big part of that is learning how to really understand what is going on in our lives right now, seeing it as it really is, not avoiding looking at things that are painful, because it's through awareness that we can start to grow and to heal, but also not exaggerating our experience either. So seeing our reality and then working with that.
Okay, thank you, Ian. That sounds really, really interesting. It feels a lot to sort of take in at the moment. So I wonder if you wouldn't mind just summarizing in a few sentences, just to make sure that I've understood what you said, if that's okay.
Yeah, of course. So I guess I would say that ACT is an evidence-based therapeutic approach. It's about supporting people to make value-based decisions to maximize their potential to live a meaningful life, whilst acknowledging and accepting the inevitability of pain and struggle at certain points in our lives. So the ACT model very much assumes that there is an inevitability, that there will be some degree of struggle and pain in everybody's life, whether that's to do with frustration or rejection, disappointment, failure, or loss. There's an acceptance and an acknowledgement of that to live a full life, we also have to live a full range of human emotions, but that we can consciously approach those challenging emotions, those points of pain in our life, in a way that is as much as possible aligned with our values. So whether we can't completely get rid of challenge from our life, we can approach and we can live those challenges in a meaningful way. And some people use the analogy of climbing a mountain. So in life, there may be twists and turns and bumps that we face. It can be hard. Sometimes it can be really hard. And we need to be acceptant that there will be challenges as we go through life in the same way as climbing a mountain. We don't have to climb that mountain in any particular way. We don't have to go faster or higher than we're able. So in the same way, we can face the challenges of life at the pace that's right for us. Maybe even when we're part way up the mountain, we can stop and reflect on the beauty of the view. What an amazing thing that we've done so far, getting to the point that we've got to. Maybe stopping and reflecting just how far we've already come, how far we've climbed, how brave we're being. And in the midst of all that pain, there may still be beauty, and hopefully an even more beautiful view the higher we climb, the further we go. So that's very much the idea behind it.
Okay, thank you. And I really like the idea of life is a bit like climbing a mountain, because it can really feel like hard work at times, but also you do have to stop and look at the view sometimes. I mean, that's a lovely metaphor. Thank you for that, Ian. It gives a really good explanation of what ACT is and what it sets out to do. But on a practical level, I wonder if you could say a little bit about what clients could expect to be working on if they were using ACT as a sort of therapy model.
Yeah, absolutely. So there's a few things that if we're working with a client, we might be considering. And the first is mindfulness. It's this idea of deliberate and conscious awareness to really get what our present moment experience is. So I said earlier, not exaggerating what's going on for us right now in this moment, but also not avoiding it either. So really understanding how things are in this moment. So that might involve deliberately bringing our awareness to the situation that we're in, really connecting with and fully being aware of what our experience is like for us in this moment, seeing it how it actually is, and then working with that. Now, very understandably, that can be really hard for some people. People can be really resistant to that. People might say, I don't want to look at the things I find hard. I find that distressing.
Okay.
So one of the things that in ACT we learn is an idea that's called diffusion. So this idea of being able to just step back. So learning to detach from the thoughts and from the memories that we're experiencing, not ignoring them, not pretending that they aren't there, but then noticing them and then just stepping back so that we don't become overwhelmed by the pain that we might be experiencing in that moment. And there are lots and lots of ways of which we might go about doing that. We might say things to help reinforce that this is simply a thought that we're having. The thought may not always be right. So we might say, I notice that I'm having a thought about being anxious. So if you take somebody who has a lack of confidence, for example, we might encourage them to say, I notice that I'm thinking that I'm not good enough, helping them to see the thought, but also encouraging them to distinguish between having a thought about whatever it is they're thinking about and the thought necessarily being true, seeing it as a thought. So we work on learning how to observe our thinking rather than to become overwhelmed and tangled up in it. And as I say, there are many, many different ways in which we can go about doing that. The aim is to see our thoughts as a guide rather than something to be feared and dominated by. And if we're able to detach or to diffuse from our thoughts, seeing our thoughts simply as thoughts, it makes it far easier to look at them and to recognize them simply as being thoughts we're having in this moment. Not all thoughts are right. So remembering also that acceptance isn't about saying the thoughts are true. It's simply about saying that this is how it is. This is how I'm experiencing things in this moment. It's also not about resignation. It's not about saying it's always going to be this way. Remembering that ACT is very much about a commitment to value-driven change to the extent that that's possible and desirable. And then there's a slightly jargony term that gets called by a whole variety of different names that we might describe as the observing self. Some people talk about the rigid self versus the flexible self. So if I give an example, because it's quite a jargony term. So if you're told that you're not good at something, so if you're told you're not good at maths, for example, over time, you start to believe that. We don't try to do maths, and because you aren't trying, your maths doesn't improve, and it starts to become a self-fulfilling prophecy. So over time, you begin to believe that you simply aren't good at maths. It becomes the core you. It becomes a fixed belief. And that fixed belief can start to define you. It can define how you view yourself, how you live your life, and how you define your place in the world. So I'm not good enough leads into us never applying for the job that we want. I'm not attractive enough leads us into never being quite brave enough to speak to the person that we really, really like. So ACT just helps us to be more psychologically flexible, to just loosen the attachment a little to those descriptions that we might have about ourselves. And then there's this question that I've mentioned about values and committed action. So how do we want to live our lives? What do we want our life to stand for? How do we want to treat ourselves and others? What do we want to be remembered for? So this question of values, it's really about helping us to create a roadmap of the way we would like to live our lives in a way that has meaning to us. So I've reached a point of acceptance that my life is as it is right now. Maybe it's been caused because of the inflexibility of thought that I mentioned just now. So an example might be, I'm unhappy in my job because I have rigid beliefs about myself which have stopped me going for the job I really want. So accepting that it is like that for you right now, how might we go about making value-based decisions to change that situation? So rather than just changing job from one to another and going through that same pattern of just going from one job to another that you really don't like, we really stop and consider what our values are. So if one of our values is about being creative and wanting to live a creative life, then we might train to do something more creative. Or if one of our values is compassion, we might look at how we can become a nurse or a care worker, or work for a charity doing good work, or volunteering somewhere maybe one evening a week. But really making a commitment to make those changes that we feel are desirable and possible in order to help us live a more meaningful life as best we can.
Okay, and that's really, really helpful. Thank you so much for that. I think I've really understood ACT a lot more now you've explained it. And it sounds to me as though the approach is very much an individual basis, and it does depend completely on who you are working with. Have I got that right?
Yeah, absolutely. So ACT is a really flexible way of working, and it's always completely bespoke to whoever the client is, and whatever their needs are, and what they want to work on. Every client will have their own personal values and will decide for themselves what they want to work on and how quickly they feel able to do that and how far they want to go. It's about remembering that these things might not come in any particular order as well. So some clients will want or need to take longer on some areas than others. Also, that we may well need to loop back to things that we've talked about previously. Maybe there's work that's still to be done. Some people may have no idea about what their values are, and we need to take time working on that. Whereas for others, they might have a very clear view of things, but just have that sense of being stuck. So we spend time working on whatever the individual client's needs are. And the ACT model is really about setting value-based direction based on awareness of the unique circumstances that the client finds themselves in, and then making a commitment to ourselves towards making the changes that are desirable and possible based on that, but all done in a completely individual way at the pace that's right for the client. The client is absolutely at the center of everything that we do.
Okay, thank you, Ian. That's really helpful. That's a really good explanation of the ACT model. So, what would people expect if they were working in an ACT way? And how, if they were interested in ACT, how would they find out more about it? What would they do?
Yeah, that's a really good question, Wendy. So we've got a page on our website. People are very welcome to go and take a look at that. www.hopefulminds.co.uk/acceptance and commitment therapy. We'll also drop a link into the comments of YouTube as well, so people can link straight through to it. But the Hope Therapy and Counselling team have a really diverse level of experience, offering a variety of different therapeutic approaches. So if people are interested, if ACT may be not quite the right thing for them, we can really go through and help people to understand what's available to them. And I know you, Wendy, you have a website too. Maybe if you just tell the listeners and the viewers a little bit about that.
Yes, so my website is called wendyc.team, and it has a lot of free resources on it. If you become a member, you can access lots of courses and information on that as well. So you're very welcome to get in touch with me through wendyc.team. Ian, I want to thank you so much for a wonderful explanation of ACT, and it sounds really, really interesting. And I do want to encourage people to actually go and look at the YouTube and go on your website and find out a bit more information. And just to let our listeners know, in a couple of weeks' time, we will be doing another series, and this series will be on anxiety, but with a particular emphasis on learning about worry. So thank you so much for listening, and it's goodbye from me, and over to you, Ian.
And a goodbye from me as well. Thank you, Wendy. Bye-bye.
All right. Take good care.